That pill you took this morning with breakfast, the fruit sitting right next to it on your plate may be quietly working against it. And most people have no idea. If you're over 60 and you take any kind of daily medication, whether it's for blood pressure, cholesterol, heart health, or even something as simple as pain relief, then this video might be one of the most important ones you watch this month. Because here's the thing, we all grew up hearing that fruit is good for us. And it is. Fruit is wonderful. But after a certain age, when medications become part of our daily routine, some fruits can actually interfere with how those medications work inside your body. Not because the fruit is bad, but because the combination can cause problems that build up slowly, quietly, without any obvious warning signs. And that's exactly what makes this so easy to miss. Today I'm going to walk you through 4 common fruits that many seniors eat regularly, sometimes daily, that can interact with certain medications in ways most people simply aren't told about. I'll keep things calm, clear, and simple. No medical jargon, no panic, just good information you can actually use. So let's start with the one almost everyone has heard about, but very few truly understand. Number 1, grapefruit. Now you might be thinking, I already know grapefruit is a problem. And yes, it's the most well-known one on this list. But here's something many people don't realize. It's not just grapefruit juice, it's the whole fruit, the segments, the zest, even some marmalades made with grapefruit peel. And the reason is fascinating in a quiet kind of way. Grapefruit contains natural compounds that block a specific enzyme in your digestive system. That enzyme is responsible for breaking down many common medications. When it's blocked, your body absorbs far more of the drug than it's supposed to. Think about that for a moment. You're taking the correct dose. Your doctor prescribed it carefully, but because of a glass of juice at breakfast, your body might be absorbing 2 or even 3 times the intended amount. This is especially important if you take statins for cholesterol, or certain blood pressure medications called calcium channel blockers, or some heart rhythm drugs. Let me share a quick example. Margaret is 71. She lives alone, stays active, walks every morning. She's been on a cholesterol medication for about 4 years. She started having grapefruit with her breakfast a few times a week because she read it was good for heart health. Over several weeks, she started feeling unusually tired, a little dizzy when standing up. Her doctor ran some tests and eventually asked about her diet. The grapefruit was the issue. Once she stopped, things gradually returned to normal. Margaret did nothing wrong. She was trying to be healthy, she just didn't have the right information. And that's why we're here. If you're still watching, type 2 in the comments. Just the number 2. That way I know this is reaching the people who need it. Fruit number 2, bananas. Now this one surprises people. Bananas are one of the most beloved fruits in the world. They're soft, easy to eat, gentle on the stomach. Many seniors eat one every single day, and for most people that's perfectly fine. But here's where things quietly go wrong. Bananas are very high in potassium, and if you take a type of blood pressure medication called an ACE inhibitor, names like lisinopril, enalapril, or ramipril, those medications already cause your body to hold on to more potassium than usual. When you add a potassium-rich fruit on top of that, levels can climb higher than your body is comfortable with. Too much potassium doesn't always announce itself loudly. Sometimes it shows up as muscle weakness, an unusual heartbeat, a strange tingling feeling. Sometimes there are no symptoms at all until levels get quite high. Have you ever felt an odd flutter in your chest and just brushed it off? It might be worth thinking about what you ate that day and what medication you're on. Now, I want to be clear. I'm not saying bananas are dangerous. I'm saying that if you're on certain medications, it's worth having a simple conversation with your doctor or pharmacist about how many bananas, or other high potassium foods, are right for you. 1 banana a day might be perfectly fine for your situation, or your doctor might suggest cutting back to a few per week. The point is to ask, that's all. Fruit number 3, pomegranate. This one is becoming more and more common in senior diets, and for good reason. Pomegranate is rich in antioxidants. It's in juices, supplements, even smoothie mixes marketed directly at older adults. But most seniors are surprised when they learn this. Pomegranate can interact with blood-thinning medications, specifically warfarin, which many seniors take to prevent blood clots or manage atrial fibrillation. Pomegranate may increase the effect of blood thinners, which means your blood could become too thin. And when blood gets too thin, even a small bump or cut can lead to unusual bruising or bleeding that takes much longer to stop. This is where it gets tricky, because the interaction doesn't happen dramatically, it builds gradually. You might notice a bruise on your arm you don't remember getting, or your gums bleeding a little more when you brush your teeth. Small things, easy to dismiss. And pomegranate can also affect how certain statins and blood pressure medications are processed, similar to grapefruit but through slightly different pathways. So if you've recently added pomegranate juice to your morning routine, or started taking a pomegranate supplement, and you're on any of the medications I just mentioned, it's genuinely worth bringing up at your next appointment. If this part makes sense, type 4 below. Just the number. It helps more than you know. Fruit number 4, cranberries. Now, cranberries have a wonderful reputation, especially among seniors. Cranberry juice has been a go-to for urinary tract health for decades. Many women over 65 drink it regularly, and some men do too. But here's something that catches people off guard. Cranberries, and especially concentrated cranberry juice, can interact with warfarin as well. Studies have shown that cranberry products may enhance the blood-thinning effect of warfarin, raising the risk of bleeding events. And because so many seniors drink cranberry juice as a daily health habit, they never think to mention it to their doctor. It's juice, it's natural, it feels harmless, but natural doesn't mean it can't interact with a powerful medication. There have also been some reports of cranberry affecting how the body processes certain medications broken down by the liver. So if you're on multiple prescriptions, which many seniors are, cranberry juice could quietly be shifting the balance without anyone noticing. Does that make you think about what's sitting in your refrigerator right now? Sometimes the smallest habits deserve a second look. Now let me take a step back and say something important. This video is not about fear. It's not about throwing away your fruit bowl. Fruits are still some of the healthiest foods on the planet, and most of them are perfectly safe for most people. What this is about is awareness. After 65, your body processes things differently. Your liver and kidneys work a little more slowly. Medications stay in your system longer. And when you add certain fruits into the mix, the chemistry inside your body can shift in ways that are subtle but real. The simplest, most powerful thing you can do is this. Next time you visit your doctor or pick up a prescription at the pharmacy, bring a list of the fruits you eat regularly. Not just medications, not just supplements, the foods too. Pharmacists, especially, are often wonderful at catching interactions that even doctors might not think to mention. And it takes 2 minutes, that's all. Here's a thought worth sitting with. How many mornings have you taken your pills right alongside your breakfast without ever considering whether the food on your plate might be part of the equation? You're not alone in that. Almost everyone does it. But now you know a little more. And knowing is what gives you the power to make calm, informed choices. Before I let you go, let me gently say this. If anything in this video made you pause or rethink a small part of your daily routine, that's a good thing. That's not worry, that's wisdom. And wisdom is something that only comes with the years you've already lived. You don't need to change everything overnight. Just start with one conversation, one question to your pharmacist, one small adjustment if it's needed. And if you found this helpful, I'd love to hear from you. Leave a comment and share which of these 4 fruits surprised you the most. I read every single comment, and your experiences might help someone else watching this who's in the exact same situation. If you'd like more videos like this, calm, clear, and made with seniors in mind, consider subscribing. There's no pressure at all, but I'll be here, sharing what I learn whenever you'd like to come back. Take good care of yourself today. You deserve it.